Hello, everyone. Welcome back to class. I hope you are doing well. It was nice getting to read a little bit about you, and I look forward to getting to know you better throughout the course of the year. It's always unique when we are in this asynchronous virtual learning environment. Please feel free to reach out to me via email or stop by my office or via email, set up a time for us to talk on Zoom or in person. I want to make sure that your learning experience is a great one and that I'm able to answer all of your questions, especially during ARP I and ARP II, to help prepare you for success as you work on your final manuscript. Now, this week we're talking about creating a PICO, and I think creating a PICO is something that you've had exposure to previously. And so if that is the case, then some of this will be review. But creating a PICO is really the way that we go about helping to frame a clinical question and help us think about what the situation is so that way we can do a good job searching out appropriate literature to best help our patients. And so that's the PICO, P being our population of interest, I being our intervention. It's usually the thing that we are curious about. What is the best approach? Or does this new approach, is it superior to the old approach? The C is the comparator. That is often the standard of practice, the old approach, or sometimes it can just be simply the control, like no intervention. And then, of course, the O stands for our outcome. Sometimes you'll read people adding in a T or two T's. We're not going to worry about that. I'm not sure that that is the standard approach, but if we take a look, what would the T's also mean? Well, sometimes people will think about T as in the type of clinical question. So is it something that is diagnostic in nature? Is it something around harm, therapy, prognosis, or prevention? I really think if you write a good P, your patient problem, and you have a good clinical question in mind, you don't really need to worry about that T. The other T is the type of study design you want to look for to answer your question. And again, when you're doing your PICO, I don't think that T is ultimately necessary either, because it's incumbent upon us to be able to look at a piece of literature and to know that a randomized control trial is preferable over a case report or a case series. So what are the best study designs to answer clinical questions? In many cases, it's a randomized control trial. Now, there may be other situations where cohort studies are appropriate, especially if you're looking for things related to prognosis or harm. Those can be definitely beneficial. So here is a table laying out PICO and what that might look like if you were doing a therapy, diagnosis, prognosis, or risk, etiology, or harm type of study. Now, the P obviously is for patient across the board. The I now is highlighting the things of interest. Probably the majority of you will do a therapy-related study, and so you're looking at interventions. I think that's been the vast majority the past 2 years in this program. Diagnosis, you're looking at different tests. For prognosis, you're interested in prognostic factors, and in the far column, looking at risk and harm and things like that, you're interested in the risk factor. For C, we've got our comparison intervention under therapy. Diagnosis, the gold standard test, right? Because if we've got a gold standard test, we want to see if that new test, which may be less expensive, may be less invasive, if it's better than the gold standard test. And then for prognosis and the risk categories, it's the absence of those factors. And then finally, the outcome is listed there, and that is the same across the board, meaning for like therapy, what's your outcome of interest? Did it improve health measures? For diagnosis, did it do a better job of correctly making a diagnosis? So this here, just for your reference, this comes from the Centers for Evidence-Based Medicine. And this then illustrates under some of those different clinical questions, if it's a diagnosis, treatment intervention, et cetera, what the types of studies are that would be considered level 1, level 2, level 3, level 4, and level 5. What you want to do for your future project is to try to get as many level 1 and level 2 studies as possible. Now, I'll put a little asterisk by that there. Ultimately, things are going to depend upon what type of review you're doing. Our primary ones are either a systematic review or a scoping review, and we'll talk more about that in the coming weeks. If you're doing a systematic review, you definitely want to have a paper that only has randomized controlled trials. If you're doing something like a scoping review, you may be interested in finding out all the available current evidence on a topic. It may be so new that there hasn't been a lot of randomized controlled trials. Or your clinical question may be so narrow that there isn't a lot of randomized controlled trials to support that. And so you have to take a look at whatever is available. I have published, prior to being involved with this program, a few different systematic reviews. And as I just mentioned on the prior slide, it is ideal to have systematic reviews that have mostly randomized controlled trials or have only randomized controlled trials. This was a paper that I did with a friend, and he was the lead author on it. I assisted him. The journal allowed it to be a systematic review. As you can see, we had some systematic reviews, but we also had some other publications involved that weren't systematic reviews. In this particular case, if you were replicating this study now in 2026, I might recommend that you should be doing a scoping review or maybe some other form of review versus a systematic review. Here is that hierarchy of evidence. Have you seen this before? Probably you have. That pyramid shape, and at the top are the forms of evidence that we consider to be of greater importance. And maybe greater importance is not the right word, but better strength of evidence. And so what have we got? At the top, we've got systematic reviews with or without meta-analysis. And those are the studies that look at all the randomized controlled trials on a particular topic and then does a statistical procedure to appreciate the ultimate effect on patients. Randomized controlled trials right below systematic reviews, that makes sense because a randomized controlled trial is just one, whereas a systematic review has multiple randomized controlled trials reviewed as part of that process. Randomized controlled trials, great for treatment and diagnostic questions. The next level, the cohort studies. These are good for prognostic questions as well as risk-related questions. Case control studies are also for prognosis and studies related to harm. And then at the bottom are case series and case reports and studies that don't involve human populations. Here's just a different version. You're going to see a lot of different versions out there. I like this one just because it shows that arrow, the quality of evidence going towards the top. So there's more strength to that. You would prefer to make your clinical decisions looking at the studies near the top of the pyramid versus those at the bottom. Now, one question that comes up is, can I use a systematic review within my paper? And the answer is no, you shouldn't. If there's been a recent systematic review on a topic, then you should be trying to look for something different because you're just going to be repeating the wheel. If the systematic review is 5 years old and there's been a lot of randomized controlled trials since then, there may be a valuable story to tell, especially if newer evidence suggests to do something different. So there are 5 A's of the evidence cycle: assess, ask, acquire, appraise, and apply. So as a physician assistant or physician associate, you perform clinical evaluations. Your first A in the evidence cycle is to assess. The method of evidence-based clinical practice begins with a thoughtful assessment by a clinician who incorporates all pertinent data. Now, ask. The first critical step is to clarify 1 or 2 key issues that come up in the course of caring for your patient and to develop a focused clinical question. For example, as a physical therapist, I might want to know what is the best physical therapy treatment for patients with subacute low back pain. And this is where the PICO comes into play. So, my PICO for a 30-year-old patient with subacute low back pain: what is the best physical therapy treatment for reducing pain? And I could further define the low back pain. I could describe it as not being radicular beyond the point of the knee, and that there was a negative neuroscreen, so no neurologic involvement at the level of dermatomes, myotomes, and reflexes. So I might be curious, is spinal manipulation superior to range of motion exercises? And again, your C could sometimes be standard practice, usual care, it could be wait and see, something like that. And then my outcome of interest for this PICO that I've created could be pain utilizing the visual analog scale. Next, we need to acquire. So you've got your PICO question. Attention now turns to finding the evidence in the medical literature. Now, next week, we're going to explore how to search the literature. And again, I know that you have some skills developed in this area and will continue to work on that. In subsequent weeks, we will review study designs and the pros and cons of each. Next, to appraise. So performing a critical appraisal of the evidence. There might be different tools out there that you can use to quantify the quality of a particular study. This could be an option. Let's say there's lots of studies, especially randomized controlled trials or cohort studies. You could utilize something like a Quadis tool, and you could maybe define studies that are included that met a Quadis score of 10 or greater. I'm only throwing that out there in case you come across any papers this term that use that as criteria. I don't know that people utilize the Quadis a lot, but again, it's just a tool out there, and I'm sharing that with you. Here's the modified, and I believe it's pronounced JDOD, but I'm not 100% sure on that. Just another tool to appraise the quality of a study. Sometimes you'll see people provide a sort score, a strength of recommendation taxonomy score. And this comes from a different systematic review that I was part of. And this was a way for us to summarize the findings of that study, of all the studies. This will not be something that you have to include in any of your papers. But I just wanted you to be familiar with it as a tool that helps appraise the literature. And so what we did is we came up with a clinical recommendation. So for example, implementing a hip strength and coordination program is an effective component of a conservative patellofemoral pain syndrome treatment plan. And we gave it a B because that's what the level of evidence was at there, an inconsistent or limited quality patient-oriented evidence. Next, the next A is applying evidence to the patient. Basically the final step where you have now decided whether you're going to implement the findings from a study or studies or not. So your turn this week is to create a PICO. So in the discussion section, you're going to write out your PICO. There's an example on the next slide as well as an example on Canvas. You're not required to respond to classmates' posts. I will do some responding and or asking questions to further progress your PICO. The PICO that you put this week does not need to be the same as the PICO that you will use for major assignment 1. Now, if you already have kind of figured out what you want to do, outstanding. But if you don't, that's okay. And so this week is an opportunity for you to kind of play around and practice. The instructions for major assignment 1 are presented in this week's module. Your major assignment 1 is not due until week 10. So now you can start taking a look at it, and you can take a look at a couple examples and start slowly working on things. Here's another PICO example. There's one other Google Doc link that I have in this week's module, and this is part of our process of trying to identify potential committee members that can be beneficial and effective for you for your dissertation. Your dissertation committee will have a chair, a point person that you'll work closely with, and then 2 other members. So sometimes I am a chair, sometimes I'm a committee member, sometimes I'm not on a project, but I'm still going to be throughout all 3 courses providing edits and comments. Same thing with Dr. Justice. But we also want to expand things. So for example, a few years ago, a student did a topic around lavender supplementation for individuals with mental health care diagnoses. And we were able to get a member of the psychology program to be on her committee. So what I'd love you to be able to do, and you can start this process now. Maybe you've got your PICO figured out. Great. Put your name and put your research topic. So for example, if I was doing something around what's listed on this slide, I'd put my name, Jason Brummett, and I would write that my research topic is going to compare the Mediterranean diet and the standard American diet and look at cholesterol levels and blood pressure. I will then, once we've got everybody's information shared in there, I'm going to share it with other healthcare providers within the university. And so you'll potentially have not only members of your PA program available to serve as chairs and committee members, but also individuals from across the university who might be great content experts. All right, I think that addresses everything for this week. Please have your PICO discussion post completed by Sunday midnight of next week.